Hey you guys. Okay, so yesterday we did a video for the women's health tips, and I did say that I was going to try my best to do a men's health tips video between tonight, oh not tonight, it's tonight now, between today and Saturday, and I want to, do my best to keep my word because I'm trying to do these at least once a year, once or twice a year. So we did the women's yesterday and we're doing the men's today, and we did one last year as well. So I'm going to be, because I'm not a guy, I'm going to be just basically looking up different links and giving you guys the links. So this first one is going to be healthywomen.org, but it's talking about 10 health tips for the men in your life. So ladies, if you have a son or your husband or maybe your uncle or father or whomever, that this is for, or if you are a guy that is subscribed to this channel or as a viewer, I hope you get something out of this. If you don't know it, and then we'll be coming from there was like two other links I wanted to come from, and I won't be before you guys long. But this is saying from Healthy Women Home. It says, we all know that it's common for men to skip the doctor until they become sick. Encourage the men in your life to stay on top of their health with these simple steps. And then it also says, we all know that it's common for men to skip the doctor until they become sick, injure themselves, or are faced with a serious health problem. And the majority of men will postpone seeking care for a few days to see whether they feel any better. It's the whole if it ain't broke, don't fix it line of thinking. But these are steps the men in your life can take today to improve their vitality and help prevent health problems down the road. Of course, there are some things that can't be changed, such as family, history, and age, but everyday choices can have a big impact on their current and future health. And then it's they also have where you can click there for a printable version, but it says, offer the men in your life the following tips for staying healthy. Again, this is from healthywomen.org, 10 health tips for the men in your life. So if you Google this, it will come up. So it says health tips for men. Get routine health checkups, screenings, and don't forget dental exams. Just because you're healthy doesn't mean you're off the hook. Going to your healthcare provider for regular checkups could just save your life. By keeping up with these appointments, your healthcare provider can make sure you stay up to date with immunizations. Yes, they're for adults too, and important preventative health screenings. It also gives you a chance to talk about any health concerns or changes you've noticed. Make sure to talk with your healthcare provider about your family medical history and that's which screenings you might need. For example, body mass index, BMI, cholesterol, blood pressure, certain cancers depending on risk factors, including your age and family history, like example, lung, colorectal, prostate and skin, diabetes, blood glucose, sugar level, depression. Did you know men are 4 times more likely to commit suicide than women, which is thought to be due to underdiagnosed depression? And we're not endorsing that, guys. I'm always pointing you guys back to God. Men, I do want to encourage you, because we all deal with different things. I do want to encourage you, though, to open up to the woman in your life that you trust. I know a lot of times guys, they compartmentalize things, or they just suppress and repress things. And, someone that you can trust, you can, open up and talk to them about it. And, you definitely can trust God and talk to him about anything, but don't hold it in. So that's one of them, guys. Talks about sexually transmitted diseases. And if you're like most people, you dread going to the dentist, but add that to your to-do list. Dental exams aren't just important for your teeth and gums. Your mouth may also be a red flag for other health conditions. And it has more if you click on the link. The next point, it says eat a healthy, well-balanced diet. Eating a diet that's low in fat, less than 7% of calories, should come from saturated fats, cholesterol, and salt, and packed with fresh fruits and vegetables. 2 cups of fruit per day. 3 cups of vegetables per day for men up to age 50, and 2.5 cups for men age 51 and over. Whole grains and fiber can help improve your health, prevent heart disease, diabetes, and certain cancers. And I also just want to say, quick sidebar, I believe I said this before in some prior videos, that it's good to talk to people you can trust, whether that be a counselor, a pastor, a close friend, someone you really can trust that's confidential, that's not going to throw things up in your face, that it's like a safe space and place, right? I believe that's for women and men. So this says 2 cups of fruit per day, 3 cups of vegetables per day for men up to age 50, and 2.5 cups for men age 51 and over. Whole grains and fiber can help improve your health, prevent heart disease, diabetes, and certain cancers. It says get moving. Sorry guys for the background noise. It's getting late, so it's a lot of activity. But get moving. Try to get 30 minutes of moderate physical activity on most days of the week. Taking a walk, jogging, swimming, and mowing the lawn all count. But don't be a weekend sports warrior. Start slowly if you aren't normally active and gradually build up. No time. Research shows that even short bursts of physical activity, as few as 10 minutes of intense activity several times a day, can help men improve their health. Talk to your doctor about the right exercise program for you. It says lose the gut for good is the next one. It's important to maintain a healthy weight. Excess weight, especially around the waist, can be hard on your body. Carrying too much body fat forces your heart to work harder and increases your chances of heart disease and stroke, even if you have no other risk factors. So try to curb weight gain as you age. It also talks about drink alcohol in moderation. Don't use tobacco. Again, I'm not saying I endorse it, but different people, maybe living different lifestyles. I'm just reading, guys. I'm not endorsing it though. But it's saying, if you drink alcohol, limit your consumption to no more than 2 drinks per day. And it goes on to say some other things. I would just say don't even, but different people are in different levels, right, guys? So don't use tobacco, and I pray that God would deliver you, Okay, don't use tobacco. Tobacco smoke contains more than 4,000 chemicals and is a known cause of cancer. Smoking also increases the likelihood of high blood pressure, heart disease, lung problems, and other health problems. And if you think chewing tobacco is safer, think again. Not only is chewing tobacco a known cause of cancer, carcinogen, it also contributes to gum disease and tooth loss and may be linked to fertility problems. And few could argue that chewing and spitting is attractive to a partner. If you smoke or chew, talk to your healthcare professional about ways to quit. Consider nicotine replacement therapy products that include self-help programs if appropriate. It mentions practice safe sex. Preferably you guys are married or, it says buckle up every time. And even going back to, I won't get too personal, but even going back with that tobacco, people that I've dated in my past, like before salvation and stuff, a lot of that is what they're saying is very true. With the cancer and the gum disease and, just what it does to a person's body and the fertility problems, all of that plays a big role. And it also plays more roles than that because sometimes people, they want deeper than just the tobacco. They want to go to the next level. It may be cocaine, it may be heroin, it may be, they want something deeper. When it comes to drinking, it may be something deeper and they want to start mixing stuff. And it's like, it can get you addicted in different ways, so it's just better not to even, go down that road. Or if you're on that road, I encourage you to, come off that road and go into something else, Okay, so buckle up every time. Always wear a seatbelt when you're in a motor vehicle to prevent death or serious injury in an accident. Obey all rules of the road. Don't be a distracted or aggressive driver. Limit cell phone use and don't use other electronic devices while driving. Okay, think about safety in everything you do. Whether it's pulling out the weed whacker, going for a bike ride, or grilling with the neighbors, safety is key. Here are just a few examples. Take care when moving heavy objects. It's easy to sprain yourself when lifting boxes, furniture, and other heavy items. Use your knees and legs and not your back for leverage, and ask for help if you need it. Wear appropriate protective gear for your eyes and ears when using leaf blowers, lawn mowers, and other machines at home or work. Excessive exposure to noise is the most common cause of hearing loss. Wear a helmet when you ride a bike or ski and throw on reflective clothing if you go for a run after dark. When grilling, never leave the grill unattended, especially when small children and pets are around, and keep a fire extinguisher handy. The grill should be at least 10 feet from your house or any building. To protect your skin, avoid prolonged exposure to the sun and apply and reapply sunscreen with an SPF of 15 or greater that provides protection against UVA and UVB rays. And it talks about learn to manage Learn to manage stress. Many men define themselves by their careers, which can raise stress levels. Over time, stress can take a toll on your emotional and physical health. Notice early warning signs of stress such as irritability, tension in your shoulders and neck, grinding your teeth or clenching your hands into fists, and find healthy ways to de-stress. For example, exercise, meditation, massage. Talk to family and friends about how they can help you integrate these tips into your everyday life and stick with them. Meditation, I would just suggest meditate on the Word of God, so you're not opening up yourself to other things. But that was from that one, and I'm going to go out. This one, it says 7 important tips for men's health, and it's from Guadalupe Regional Medical Center. And I think it's pretty much kind of saying the same thing, but not saying the same thing. So I'll just give you guys the tips it's talking about, but without reading everything. It says have regular checkups, right? Even if you feel okay. Schedule an appointment with your doctor when something doesn't seem right. I will read number 2. So it says, it's also important to see a doctor if you have noticed changes in your sleep or bathroom habits, have a cut or sore that doesn't seem to heal, notice changes in your moles or birthmarks, or if you're experiencing unexplained weight fluctuations or sexual dysfunction. Remember that many significant health issues begin as minor problems that could have been prevented or better managed if they had been detected early. Rather than thinking it's just a matter of toughing it out, invest in your future good health by discussing your health concerns with your doctor. Also, they have here for number 3, know your family history and share it with your doctor. If your dad or other family members have a history of hypertension, heart disease, diabetes, or other chronic health conditions, you may be at a higher risk for developing those conditions yourself. Your doctor can help you develop an action plan to minimize those risks and increase your chances of early detection. And before we get into the other couple of points, I just want to say, if you haven't been to the doctor, to go get checked or, do that. If you were able to do that this year, do that. If you're able to go out and exercise, do that. If you're able to take a break, take a breather, do that. If you're able to have some you time, in moderation, but do that. If you're able to eat healthier, get a walk in here or a good bite in there or some water intake, do that. Do something this year that your future self is going to thank you for. Do something today, this week, this month, this time, this year that next year you'll be glad that you did. Sometimes if we want something new, we got to do something new to get new results. It's talking about get some exercise. Ideally, you should exercise at least, getting back to this online. Ideally, you should exercise at least 30 minutes a day. But if you're having difficulty squeezing in a workout, remember that even a brisk 20-minute walk a few times a week with your spouse or regular play outside with your kids or grandkids can provide heart healthy and stress relieving benefits. And then it gives you to check out the Guadalupe Regional Wellness Center link. It's talking about give yourself permission to take a break. For number 5, knocking off once in a while to play golf, head to a ball game, or watch TV with your family aren't just fun ideas. They're best practices that help you keep stress at bay. If you're having difficulty finding room for leisure, look for creative ways to get some you time, like listening to audiobooks and podcasts on your drive to work or while you're taking care of the yard. 6, ask your doctor about cancer screenings. Based on your age, family history, and lifestyle, your doctor may recommend that you undergo screening for colon cancer, prostate cancer, or lung cancer. And it's talking about stop smoking for number 7. Okay, I think this is going to be the last one, guys. 10 health tips for men of any age. This is from healthgrades.com. And I'll read a little bit of this because I don't want to be repetitive, but I'm trying to give you guys as much as possible. You guys know I'm not a doctor. I just, trying to share the information, Okay, so 10 health tips for men of any age, healthgrades.com, and then it has some other things at the ends, but it's advantageous to protect your health. If you're like most men, you probably have a career plan and a retirement plan. It may be even a plan for starting or providing for your family. But do you have a plan for keeping yourself healthy? While some health issues are beyond your control, there are several ways You can keep your mind and body strong and healthy. Here are tips for protecting your health at any age. Start your healthy living plan today. Number 1, it says hang out with friends and family. You might think you're too busy for a boys' night out or a lunch with your mom, but activities like these may save your life. Research shows that social ties can help you survive health problems, make you happier, and even prolong your life. One study even found that social bonds can protect your physical health as much as quitting smoking. Number 2, don't smoke. You guys keep seeing that pop up, but don't smoke. Smoking is the major cause of lung cancer. Lung cancer kills more men than any other type of cancer. Smoking is also linked to heart disease, stroke, and COPD, chronic obstructive pulmonary disease. And half of all long-term smokers will die because they use tobacco. The good news is that as soon as you stop smoking, you start to decrease your risk of developing chronic diseases. And it gives you links and tips on, how to stop or how to quit smoking. Number 3, eat a healthy diet. Takeout food may be tasty and easy, but you have to be smart about the kind of quick food choices you make. Too many fatty foods and sugary drinks increases your risk of developing heart disease, diabetes, and cancer, and you'll risk packing on the pounds. Instead, work on eating more vegetables, fruits, lean proteins, and whole grains. 4, break a sweat. Exercise can reduce your risk of heart disease, stroke, diabetes, colon cancer, and other health problems. It can also keep your weight down and sharpen your judgment. Plus, you will likely sleep better and live longer. So try to get at least 2.5 hours of moderate intensity activity every week. This can include things like yard work, riding a bike, and shoveling snow. Number 5, unplug and take a break. Small amounts of stress can energize you and sharpen your ability to perform well. But too much stress over time can cause serious physical and mental health problems, including heart disease, diabetes, digestive problems, sleeplessness, and depression. To de-stress, get some exercise, meet up with friends, take a break from the phone and computer screens, and try other health tips from the American Heart Association, and it gives you the link. 6 is get plenty of rest. It seems like there are never enough hours in the day. As a result, at least 25% of Americans are sleep deprived. This is what we were talking about last night during our women's discussion. Sleep. We're blessed with 24 hours each and every day. Everyone uses their time differently, but we should all have the mentality, I am worth 7, 8, 9 hours a night for rest. I'm worth that, because the better that we are to ourselves, the better we can be to others. We all know what it's like when we get sleep and, the benefits of it and how, it affects us and who we're around and when we don't get sleep. And it's not saying that every day we'll get that sleep, but, sleep is very important because so much happens with our bodies as we rest, But getting back to this 6, get plenty of sleep. It seems like there are never enough hours in the day. As a result, at least 25% of Americans are sleep deprived. Too little sleep is linked to obesity, accidental trauma, heart disease, depression, and diabetes. It also puts you at risk of car accidents due to drowsy driving. Sleeping 7 to 9 hours per night can improve your work performance, your physical safety, and your body's ability to fight disease. And it gives you a link on some different tips so you know how to do it. Of how to do that. Number 7, go to the doctor. Even if you feel fine, again, regular checkups and screenings are vital for protecting your health. How important? They will help you spot signs of serious diseases and conditions early when you have a better chance of successfully treating them. You'll also be more likely to find problems before they cause painful or bothersome symptoms. And you'll live a longer and more active life free of disability. And then it gives you some links of how to find a primary care doctor, scheduled checkup, and free for a quick reference, read top 10 checkups and screenings for men. I think we may read that. Also, it talks about lend a hand in number 8. Studies have found that helping other people can decrease blood pressure, stress levels, and chronic pain. It can also reduce your likelihood of having depression and can help you live longer. And helping others doesn't have to be a big deal. You can donate to a fundraising drive, mow a labor's grass, or run a race for charity. I also would like to say on the flip side, though, too, that you got to know when to not overextend yourself so much, because there are some people where they help too much and they experience burnout, and it may cause them to feel regret or resentment and different things because they feel like, well, what about me? Or I'm helping, and like, what about me? So I feel like this is a flip side, like a coin. You got to know when to help, and also know when to say no. Like, the power of those two words, yes and no, play a big hand. It's talking about don't skip the sunscreen, limit alcohol, and it talks about some other things. But I think we're going to close with these top 10 checkups and screenings. This is from the same thing, health grades, but this one is top 10 checkups and screenings for men. I'm just going to read it to you guys because it gives you the difference between checkups and screenings. And it says, it's striking that men are 24% less likely than women to have visited the doctor during the past year, according to the Agency for Healthcare Research and Quality, AHRQ. But it's vitally important for both men and women to get regular checkups and screenings. These visits can help you stay healthy and spot signs of serious diseases and conditions early when they are most treatable. So here's the difference between checkups and screenings. It says medical checkups and screenings are two different things. Checkups are visits to evaluate your health. Physicals and well checks are other names for checkups. During a checkup, a doctor will examine your body and talk with you about your health. You will go over symptoms you have, medications you take, and your lifestyle habits such as exercise and eating. Screenings are medical tests that can find diseases or conditions before you have symptoms. Screenings include blood pressure measurements, blood tests, and colonoscopies. Your doctor can provide some types of screenings in the office. Others are only available at a specialty clinic or hospital. So some common screenings and checkups. The checkups and screening tests men need and when they need them depends on their age, health, and personal risk factors for certain conditions. So number 1, physical exam, well check. Sorry guys, it's popping up so many different ads and pop-ups. Okay, so it says physical exam, well check. What it is. Physicals are regular visits with your doctor to check your general health. At a physical, your doctor will examine your body and talk to you about your health. You will have basic screening tests such as a blood pressure measurement. Your doctor will also make sure your immunizations are up to date, and then it says, it gives you a link where you can see it. It says when you should have it. Check with your doctor to see how often you need a physical exam. Guidelines vary depending on your age and health. In general, men should have a physical every 1 to 3 years. So number 2 is prostate cancer screening. What it is. Prostate cancer screening detects prostate cancer before you have symptoms. There are 2 ways to screen for prostate cancer. In a digital rectum exam, DRE, your doctor inserts a gloved finger into your rectum to feel for changes in your prostate gland. A prostate-specific antigen PSA test measures a marker for prostate size in your blood. Both tests detect changes in the prostate gland but do not interpret what those changes mean. More testing is necessary if the results are positive. When you should have it. Ask your doctor if and when you should have a prostate cancer screening. Guidelines vary, but the American Urological Association, AUA, suggests tailoring screenings for each man. In general, the AUA considers prostate cancer screening to be most beneficial for men between 55 and 69 years. However, they also recommend men in this age group discuss the potential benefits and harms of screening with the primary care doctor or a urologist. The AUA and other organizations also recommend men younger than 55 with a family history or of African American descent discuss prostate cancer screening before undergoing testing. Screening is not advised for men 70 years of age and older. Number 3, STD, sexually transmitted disease screening. What it is. STD screening tests look for evidence of infections contracted through sexual contact before you have symptoms. STD tests are also sometimes called STI, sexually transmitted infection tests. They often involve a small blood draw. Ladies, I would also recommend this for you also. I know many of you is, not for you to get, but, if it's for you, just, when you should have it, ask your doctor about which STD screenings you may need, if any. The need for screening depends on whether you have risk factors, such as having multiple sexual partners, using IV drugs, and having sex with other men. If you don't have risk factors, you don't need STD screening. Now, again, we're not promoting this. I'm just reading it for what it is. I'm giving you guys the links to them, because you never know who's coming across the video, so, glory to God. But, okay, so it talks about that, like if you the U.S. Preventive Services Task Force recommends screening for HIV and syphilis in men with risk factors. So because this thing is going to close soon, guys, I'm just going to kind of tell you some of the other tests that it's talking about. 4 is talking about cholesterol and blood pressure. A cholesterol test measures the level of cholesterol in your blood. This test helps predict your risk of heart disease and stroke. Blood pressure checks helps doctors assess many diseases and conditions, not just high blood pressure, hypertension. If you have high blood pressure checks also evaluate how well your treatment is working. These tests are vital because high cholesterol and high blood pressure usually have no symptoms, and they are risk factors for heart attack and stroke. And it talks about when you should have it every 5 years starting at age 20. It also says some other things like Health and Human Services recommends people with normal blood pressure lower than 120/80 have a blood pressure check every doctor visit, or at least every 2 years. If you have high blood pressure higher than 120/80, you should have frequent checks, but at least yearly. It also has diabetes tests, colonoscopy, bone density tests, hearing and vision screening, oral health checkup, and abdominal aortic aneurysm screening. So those are some of the tests that you guys, can look into. And also you guys can read this. It's healthgrades.com. Let me see, healthgrades.com. Right Care Men's Health Top 10 Checkups and Screenings for Men. And the key takeaways is stay healthy with regular health checkups and screening tests. Discover diseases and conditions early so you have the best chance of treating them successfully. Visit a primary care doctor regularly for your entire life, even if you're feeling well. Ask your doctor about other additional screenings and follow-up appointments based on your screening results and medical history. And the abdominal aortic aneurysm AAA screening detects bulges in your aorta. The aorta is the main blood vessel that carries blood from your heart. Part of it travels down through your abdomen to supply the lower body. Left untreated, AAAs can burst and cause internal bleeding, shock, and death. AAA screening is a short ultrasound exam of part of your abdomen, and it tells you when you should have it. It's, if for men that have smoked, men who have ever smoked should have AAA screening once between the ages of 65 and 75. Oral health checkup. That checkup involves getting the teeth cleaning, an oral health exam, and x-rays of your mouth. These checkups help you keep the ability to chew, speak, and smile. Your dentist can also diagnose oral cancer, gum disease, mouth infections such as cold sores, and other conditions that can spread to the rest of your body. And it talks about when you should have it. You should have a health checkup, oral health checkup, and teeth cleaning 1 to 2 times a year throughout your adult life. And it says your dentist may recommend more frequent checkups if you have chronic diseases such as diabetes. If you don't already have one, then you can find a dentist and they give you the link. The hearing and vision screening determines how well you can hear different tones. A vision screening assesses how well you see near and far, your field of vision, and if you can discern colors. Vision screenings can find eye problems before you have symptoms. They can also find signs of diseases such as high blood pressure. When you should have it, the U.S. Preventive Services Task Force, USPSTF, does not recommend routine hearing or vision screening for people who don't have symptoms of hearing or vision loss. However, many adults have basic hearing screenings at their doctor's office, and vision experts recommend getting a baseline vision screening at age 40. Your doctor will let you know how often to come back based on those results. If you have new problems hearing or seeing, see your doctor and get checked regardless of your age. Bone density test measures bone mass. Bone mass is an indication of bone strength, and it's the only test to diagnose osteoporosis. Osteoporosis makes your bones weak, brittle, and more prone to breaking. Many people think of osteoporosis as a woman's disease, but up to 1 in 4 men older than 50 will break a bone because they have osteoporosis. A common technique for a bone density test is a painless dual energy X-ray absorptiometry DEXA or DEXA scan. You simply lay still during the screening test, and it says when you should have it. And the colonoscopy allows the doctors to examine the lining of the colon and rectum. It involves a thin, flexible instrument called a colonoscope. Your doctor uses that scope, colonoscope, to look for signs of colon and rectal cancer at its earliest, most treatable stage. Your doctor can remove suspicious looking areas and also look for causes of intestinal symptoms. These include rectal bleeding, abdominal pain, and changes in bowel movements. And it gives when you should have that. Diabetes test. A diabetes test analyzes your blood sugar or glucose levels. High blood glucose levels can indicate that you have diabetes or prediabetes, a condition that puts you at higher risk of developing diabetes. A diabetes test involves taking a small sample of your blood. And I think we're going to stop with that, guys. I pray that this encourages you, whether you are a female listening and this is for maybe someone that you may know, or you just a guy, that viewed or was tuned in or subscribed. I just pray that it blesses you guys and that you learned something if you didn't already know. But God bless you guys.